The transition period in dairy cows corresponds to 3 weeks before and 3 weeks after calving. This period presents a big metabolic change to the high-yield dairy cow. Adaptation in glucose, fatty acid, and mineral metabolism are necessary to support lactation and avoid metabolic dysfunction. Nutritional and other strategies are required to support fetal growth during late pregnancy and milk synthesis during early lactation. Estimates of the demand for glucose, amino acids, fatty acids, and energy by gravity uterus at 250 days of the gestation and the lactation mammalian gland at 4 days postpartum, indicating a tripling of demand for glucose, a double demand for amino acids, and five-fold increase in demand for fatty acids during this period. Also, requirement for calcium increase 4 times on the day of parturition. There are several adaptations in tissue other than the gravity uterus or lactating mammary gland. The regulation of these metabolic alterations are considered homeostasis and homeoresis, as proposed by Baumann and Curie in 1980, especially that ones in adipose tissue and liver. The cow depends on the homeoretic controls to enable to the partition of nutrients occurs. Now I'm going to talk about the adaptations that occurs in glucose metabolism. The mammary gland demands a lot of glucose for the lactose synthesis, and lactose is the most important osmotic solute in milk. The primary homeoretic glucose adaptation is the increase in hepatic gluconeogenesis and increase in oxidation of glucose by peripheral tissues. Mammary glucose uptake on the day after parturition was 9 times than that on day 7 to 9 prepartum and 5 times that on day 2 prepartum. You can see this in this graph from Bell 1995. In 1998, Overton et al. Reported that hepatic capacity to convert alanine in glucose was 2 times more on day 1 postpartum than 20 days prepartum. Now I'm going to talk about some adaptations in lipid metabolism. In early lactation, a cow goes through a period of negative energy balance because she's not meeting her energetic requirement. The primary adaptation is the mobilization of body fat stored to meet the requirement of energy of a cow during the negative energy balance period. Body fat is mobilized into the blood circulation in the form of non-esterified fatty acids, NIFA. The NIFA are utilized to make upwards of 40% of milk fat during the first days of lactation. Inadequate feed intake, dry marrow intake, and plasma NIFA concentration usually are inversely related. As you can see in the figure, the nutrients required from a mammary gland are higher than a gravity uterus. The same occurs with the energy. Now I'm going to talk about interrelationships with immune system and metabolic adaptation. In addition to the adaptations in classical metabolism that I said before, transition dairy cows also undergo a period of reduced immunological capacity during peri-parturient period. The consequence of immunosuppression is that cows may be more sensitive to disease as mastitis, decreasing the milk production. Clinical mastitis has also been shown to reduce reproduction performance in lactating dairy cows. The metabolic stress of lactation exacerbates peri-parturient immunosuppression. The transition period is a time with a lot of metabolic adaptation where dairy cows make their transition from non-lactating to lactating state. In a dairy farm is a period that remains a problematic area where the dairy farmer can lose profit, not only milk production, but also in subclinical and clinical metabolic disorders.